Nigeria. Melting pot of culture and the emerging heartbeat of Africa. It's the most populous nation in the continent of Africa and the 7th most populous nation in the world. Picture this: every 1 in 5 Africans is a Nigerian. With a population of 200 million, ensuring the health and well-being of every citizen is an enormous task for the health officials. Just like the rest of Africa, Nigeria is on the marathon towards attaining the universal health coverage.
The government of Nigeria is already committed to this goal as an integral part of its political agenda. Accordingly, the Buhari administration has prioritized the revitalization of the primary healthcare system with adequate infrastructure, fit-for-purpose human resource for health, and commodities to make it functional.
Nigeria has a lot to learn from its peers, and in March 2018, senior government officials from Niger, Kaduna and Gombe states traveled to Kenya on a South-to-South knowledge exchange visit. The trip was organized by Pamela Steele Associates under the Public Health Supply Chain Transformation Project.
I have been working with the Kaduna team in Nigeria, and we've been trying to transform the supply chain. But before we could go far, we realized the importance of coming to learn from those who have taken the same journey. And KEMSA, which is Kenya Medical Supplies Authority, has been one of those that has been talked of in the region. In fact, I've also studied their work, and I was very impressed with what I saw. So it was no-brainer to pick Kenya KEMSA as a benchmark.
On the first day, the team was hosted by the Kenya Medical Supplies Authority, KEMSA. They were taken through how the Kenya healthcare system operates and the transformation journey that KEMSA has taken to be the institution it is today. The presentations also included the role of partners in strengthening the health supply chain and the KEMSA Drug Revolving Fund.
Having studied the Kenyan Medical Supply Authority, their activities, their achievements, one has gained deeper insight and clearer understanding of public health supply system. We have seen the centrality of public health supply system in health, particularly in the provision of universal health coverage. Public health supply chain system, is like the arteries of the heart. It is the arteries of the health system as a whole.
I have been able to find out how KEMSA has been able to sustain their transformation, which is basically a self-sustaining revolving fund. So that is a huge value because we are not, in Kaduna State, we are not looking at it from that angle.
The drug revolving fund or hospital consumable activity is actually a business matter in which situation it will alleviate government expenditure, and of course it also has a sustainability framework that can sustain itself.
I was so impressed with the kind of the facilities and structures and the kind of personnel. We were briefed on the origin of KEMSA. I was so touched and impressed the way they keep and the kind of engagement and commitment within the KEMSA management and the staff.
On the second day, Madam Pamela Steele shared with the delegation case studies on drug revolving fund implementation in Kenya, Ethiopia, Sudan, Nigeria, and Yemen.
The great lesson I've learned is the emphasis laid on the supply chain system as it affects the availability of health commodities across all the tiers of governments in Kenya. And we are hoping that with this knowledge base, by the time I get back to my state, we will now get to the drawing board and reassess ourselves, and then begin to implement what we have learned here.
Later on, the delegation had a peer-to-peer session with the KEMSA staff where they tackled issues on warehouse management, distribution, information technology, sales and customer service, and quality assurance. On the third day, they visited Machakos County, an equivalent of a state in Nigeria, where they toured a medical facility and interacted with the county health supply chain unit.
For us, our pricing is to the counties. How the facilities are issuing the commodity to the patients and at what price, we really don't have control over that. But that is managed at the county level.
Since we get a common price, I think a common ordering tool from KEMSA, which has the prices, this goes to all the pharmacists across the country. We sit down with the sub-county pharmacists and then tell us we mark this up by about 20-25%, while the market rate outside might be about 30 to 35.
Today, we were privileged to hold or to have a delegation from 3 states in Nigeria who came to Kenya to look at the supply chain in Kenya, especially KEMSA, and visited Machakos to see how we relate with KEMSA and how we get our supplies from KEMSA, and the challenges that we've had in the supplies from KEMSA. And it has been wonderful. We've had a very beautiful discussion on the supply chain in Kenya and what then we can learn from Nigeria.
We are very thrilled and delighted to be in Kenya. We're quite excited to see the tremendous work KEMSA is doing in supply chain, which the CEO of Pamela still rightly described as the arteries of the health system. We deeply appreciate the synergy between KEMSA and all the levels of healthcare in Kenya. We have truly learned a lot.
On the last day, the team visited the Strathmore Business School, where Professor Gilbert Kokwaro took them through a session on leadership and governance.
The session has really shown me the role of good governance, human resource, funding for health, and all other pillars of health.
We had this discussion on leadership and governance. It was quite helpful. I've seen my role as a leader, one that should add value to assets at my disposal, and these assets will include information, people, capital. And my hope, my prayer is that by the time I'm done and I left the health system in Kaduna, one can look back and rejoice that we have left a legacy that will continue in success. And I think this is very important for me.
When they boarded the plane to Kenya, the Nigerian delegation had a lot of expectations. Were these expectations met?
My expectations for the SoSoKE has been surpassed. They are all met, but been surpassed. It was a very wonderful experience. I had high expectation before my arrival here, because I was wondering, as a public institution, how could it satisfy the needs, health needs, in terms of supply chain to the last mile. That means patients at the rural community, that's level 1, 2, and 3. How is it possible that a public institution will meet up all those satisfaction and be a source of pride for Kenya to the extent that all Africans are looking forward to? So it was a high expectation. And surprisingly, the expectations were met. I can see a full supply chain activity with clear visibility of products at the last mile at the health facility. And our trip to those health facilities shows how satisfied the patients are, and they are happy with the services that are being provided.
Accompanying the senior government officials was Dr. Sidi Mohamed from PACT West Africa, one of the organizations helping Gombe State strengthen its healthcare system.
This peer exchange learning add value to my profession, first of all, as a community health practitioner. And it also add value to the organizations that I'm working with, that is PACT West Africa, who are into capacity development for healthcare workers.
As the delegation goes back to Nigeria, there's a lot of opportunities to apply the knowledge they have acquired.
So many opportunities. We could go back to Kaduna State and start seeing how we can also impute some of the achievements we have seen here back home, like moving away from the public sector type of revolving fund to a business model type of revolving fund that will help us. Also, we can also take some of the critical factors that we have seen, like their laws and how they have been able to transfer knowledge from other private sector into the KEMSA model.
So first of all, I need to go back and step down whatever I learned to my management, to my superior, also make some kind of a true report, and at the same time see how I can implement whatever I learned here to my unit and department, so that we have a complete supply chain system like KEMSA.
From the supply chain model that we are working with, we are still at canvas level. We hope by the time we go, a lot of strategies will be put in place so that we can engineer our supply chain process in the state to meet up with the best practices and best standards as we have seen in KEMSA.
Peer-to-peer learning will be an important catalyst in hastening Africa's journey towards universal health coverage, and the participants hope that this knowledge exchange initiative will continue into the future.
We have enough, and I used to link our problem in Africa as what we call diabetes mellitus in Africa, meaning you have more than enough, but you don't know how to use it. So what I have seen is that we should strengthen this program to sustain it, and then we should also scale up to include other African nations.
We are grateful for PSC organizing this. I wasn't sure what exactly we were coming to see, but frankly, going from KEMSA down to facilities, ending up at the Strathmore Business School is a complete circle, and we can see how it all ties into the entire supply chain transformation project of Kenya, and we would want PSC to continue to organize such events even for other states in Nigeria that have not started their own transformation.
I sincerely want to thank PSA, that is SoSoKE, the South to extend knowledge for bringing 3 states from Nigeria together to come and share the experience of KEMSA of Kenya, and we believe that in future there will be regular peer review of the states and possibly even beyond African continents.
The delegation goes back to Nigeria equipped, energized and motivated to take the challenge of implementing universal health coverage head on.